dilated coronary sinus due to drainage of left-sided superior vena cava. So this is physiological condition. So you will not find any chamber enlargement, any clinical symptom from the patient side. Only thing you will find, this coronary sinus severely dilated. If you see this is left atrium, this is left ventricle, and this blue flow is aorta. This is parasternal long axis view, and this is dilated coronary sinus. So in this case, chamber is normal in size, no clinical symptom, only the chamber, dilated coronary sinus. So likely scenario is because of drainage of left sided vena cava. Normally what happens, left innominate vein and right innominate join together to form superior vena cava, but in this case left innominate vein drains directly into coronary sinus, that is called left sided superior vena cava, and right innominate drains into right atrium, that is called superior vena cava. Obviously right sided superior vena cava, but is normal general superior vena cava is also right sided structure, so that is superior vena cava. So next image, this is parasternal short axis view, this is aorta, this is main pulmonary artery bifurcating into right pulmonary artery branch and left pulmonary branch, and anterior to this one, this is left side of vena cava, this is vena cava. So if you get any structure that is anterior to main pulmonary artery bifurcation and that is joining into coronary sinus, so that is the left side of vena cava. This structure can also be diagnosed through suprasternal window. So you can either use, this is parasternal short axis view or suprasternal long axis view, slightly left to normal image, you will get left side of vena cava. Because it's left sided, so you will get left of aortic arch. So any one view if you make confidently, that is equivalent for your result. So ultimately you will diagnose this physiological condition. Chamber enlargement is not there, coronary sinus enlargement there, almost always because of left sided vena cava. This is right ventricle inlet view, this is right atrium, this is right ventricle, this is red flow is flow from inferior vena cava into right atrium. So this is flow from inferior vena cava into right atrium. This is right ventricle inlet view, and this portion is the coronary sinus draining into right atrium. So RV inlet view, this is inferior vena cava flow, this is coronary sinus. Next image, again this parasternal long axis view. This is parasternal, this is left atrium, left ventricle, this is aorta, and this is dilated coronary sinus. You can see this coronary sinus is almost touching this left atrium. So only very thin wall is separating left atrium from dilated coronary sinus. So whenever you find no any enlargement of chamber, and this is something that is joining the structure that is anterior to main pulmonary artery bifurcation. Main pulmonary artery bifurcation. So structure is, this is the some structure that is anterior to main pulmonary artery branch. Then this is left side of vena cava. Suppose in case of pulmonary vein is joining coronary sinus, then what would be the scenario? Child will have some sort of complaint. The patient will be symptomatic. At the same time, the right sided chamber will get blood from inferior vena cava, superior vena cava, and also from pulmonary vein. Ultimately, right sided chamber will get dilated severely. So if you get coronary sinus dilated with the same time right sided structure severely dilated, then that will be the scenario of total anomalous pulmonary venous connection to the coronary sinus, that is through the coronary sinus. So that is only DD in this case. As the child has no complaint, at the same time all chambers as normal, So this is the case of anomalous pulmonary, this is the case of left sided vena cava draining into coronary sinus. This is the view. This is the view from apical window. So apical 4-chamber view, simply angulate the probe posteriorly, or you can say caudally. That will give you the view of this coronary sinus in apical 4-chamber view. Simply angulate the probe caudally, that is posteriorly, you will get coronary sinus. If you angulate the probe anteriorly, then you will get aorta. That will be 5-chamber view, or aorta is coming out of left ventricle, you will get in if you angulate the probe anteriorly or cranially. So this is coronary sinus. This is coronary sinus. You can see this much dilatation of coronary sinus. This is apical 4-chamber view. You can see this is mitral flow, this is tricuspid flow, this is left atrium, left ventricle, this is right atrium, right ventricle. You see the chamber size is normal, coronary sinus is dilated. So this is the case of left sided vena cava draining into coronary sinus. Again, this is parasternal short axis view. Any structure that is anterior to this bifurcation, this image skin, the upper part of the skin is anterior, the lower part of the skin is posterior. So this is anterior. So anterior to main pulmonary artery bifurcation, a structure that is left sided vena cava, that is draining into coronary sinus. So that is the point to know from this video. Thank you.